I like to stay busy. I still work. I enjoy many activities. I enjoy long walks. I enjoy having lunch with girlfriends, just going shopping, just staying active. If somebody wants to do something, I'm usually game. My name is Nancy. I'm 65 years old, and I have postmenopausal osteoporosis. I was diagnosed 10 years ago. I was fortunate to have a doctor who was very proactive. A DEXA scan was a priority. Osteoporosis wasn't on my radar. It was until I got the results that it was a rude awakening. The DEXA results came back, and I remember her telling me my bones were thin and that my hip T-score was minus 2.5, and a couple of segments in my spine were also in the osteoporosis range. I had no symptoms. I felt fine. So I just was shocked. I got the results shortly after my mom had fallen and broken her hip. When the x-ray tech came in and she was taking x-rays, there was an audible gasp in that room when the view of her spine came up. To see her bones and what osteoporosis had done was devastating. That was my mom. That's my mom. It was a sobering experience. She was never the same after her hip fracture. She never drove again, and she walked with a walker for the rest of her life. I don't want my bones to end up like my mom's, and I know my mom wouldn't have wanted that for me. I felt I needed to do some major changes in my life. You know, I had continued doing research, buying books, going online, adding exercise, adding a little bit of weight bearing, and that's how I continued until the next DEXA. And my numbers tanked, and I was devastated. And I realized I can't do this by myself. I've got to do something better. I had done research before going in to see my specialist. I was hesitant at first to even consider medication. And I remember reading about EVENITY and how EVENITY can build bone and help slow bone loss. And I'm not sure I was a candidate actually, because I didn't have a fracture. But I thought, build bone, what a concept. When I went to see my specialist, that was the first thing she recommended after seeing my numbers. She said, I think you would be a good candidate. We discussed the side effects. I know there was a box warning for cardiovascular events. I decided the benefits outweighed any risks. This was something we agreed together. It was a discussion we had. We were both on the same page with the goal of my building bone. It was a very simple process with the 2 injections for 12 months. It was very easy. You just go in, you get the injections, and then you're on your way. I was hopeful during the treatment, and when I got the DEXA results, it met beyond my expectations. I was thrilled. I felt, this is where I should be. This is a good start. I am now in a good place to continue to just take care of myself. I feel healthy. I did have conversations with my daughter shortly after being diagnosed with osteoporosis. Because osteoporosis isn't visible, they don't see any change in mom. But now that they themselves are in their 30s, I think they're listening a little bit more about their calcium intake. Not only is the calcium important, but exercise, and then especially weight-bearing exercise. Being an advocate for osteoporosis was not a role I thought I'd ever have, but I feel I have a need to share my story, and I hope that other women will talk with their providers about getting a DEXA scan. I still feel young. The confidence level has increased. I don't feel as vulnerable. I have been making travel plans. I visited an old friend, and we did some, kind of more outdoorsy things. I don't think I would have done that, or I would have been very cautious My daughter just got married. I'm hoping for some grandchildren, and I want to be the grandmother that takes my grandchild to the zoo, walks to the park, pushes them on a swing. I don't want to just sit on the couch, I want to be the fun grandma.
Important safety information. What is the most important information I should know about EVENITY? EVENITY can cause serious side effects, including increased risk of having a heart attack, stroke, or death from a cardiovascular, heart or blood vessel problem. Call your healthcare provider or get emergency help right away if you have any of these symptoms. Symptoms of heart attack, which may include chest pain or pressure, shortness of breath, feeling lightheaded or dizzy, or symptoms of stroke, which may include headache, numbness or weakness in face, arm, or legs, difficulty talking, changes in vision or loss of balance. Before you receive EVENITY, tell your healthcare provider if you have had a heart attack or stroke, especially if it has happened in the past year. Do not receive EVENITY if you have low blood calcium or are allergic to romosozumab or any of the ingredients in EVENITY. Before receiving EVENITY, tell your healthcare provider about all your medical conditions, including if you have a history of other heart or blood vessel problems, have low blood calcium, cannot take daily calcium and vitamin D, have kidney problems or are on kidney dialysis, plan to have dental surgery or teeth removed. What are the possible side effects of EVENITY? EVENITY may cause serious side effects, including serious allergic reactions have happened in people who receive EVENITY. Call your healthcare provider or go to the nearest emergency room right away if you have any symptoms of a serious allergic reaction, including rash, hives, swelling of the face, lips, mouth, tongue, or throat, which may cause difficulty in swallowing or breathing. Low calcium levels in your blood, hypocalcemia. EVENITY may lower the calcium levels in your blood. Your low blood calcium should be treated before you receive EVENITY. Call your healthcare provider if you have symptoms of low blood calcium, such as spasms, twitches, or cramps in your muscles, numbness or tingling in your fingers, toes, or around your mouth. Severe jawbone problems, osteonecrosis, may occur. Your healthcare provider should examine your mouth before you start EVENITY and may tell you to see your dentist. Ask your healthcare provider or dentist about good mouth care. Unusual thigh bone fractures. Symptoms of this type of fracture include new or unusual pain in your hip, groin, or thigh. The most common side effects of EVENITY include joint pain and headaches. These are not all the possible side effects of EVENITY. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Indication: EVENITY is a prescription medicine used to treat osteoporosis in women after menopause who are at high risk of fracture or cannot use another osteoporosis medicine, or other osteoporosis medicines did not work well. Ask your doctor about EVENITY. Please visit evenity.com for full prescribing information, including boxed warning and medication guide.